I lived in the northwest part of Houston and in a place called Jersey Village, which was probably barely on the map at that time. Then I went to Texas A&M University and majored in biology and Texas A&M Medical School as well. Physical activity of any sort is what I like to do. I usually try and stay active. So anything that's going to get me out of the house and get my heart rate going is always good for me. I do enjoy reading religious information quite a bit, so I do that. And then just all the activities that I do with my children, which are many. Well, I think it was, there was a time I can remember studying for a biology exam in college and not really knowing what I was going to do with my biology degree. I got a phone call from my mom that my aunt had died from breast cancer, and she was fairly young age, in her late 30s, and it was just kind of shocking. And I thought, you know, I want to do something to prevent something like this from happening. What could I do? And I instantly thought, you know, the field of medicine is where I need to be. Internal medicine, you know, when you go through your residency, you get to go practice in a lot of different areas like cardiology, hematology, general surgery, etc. And general medicine was just one of those areas that you had to know a little bit about everything. You had to put all the clues together to actually find the diagnosis. Probably my mother and father, they were the greatest parents, as most kids will say about their parents, but my mom probably taught me something about humility and honesty, and my dad, perseverance, and you know, you can be all that you can be. Primary care is where it all starts. I mean, you've got to have some basis to start, and that's where it is, and from there you can, you know, delve out into other branches. I definitely know patients feel the same way I do. They miss the doctor, you know, the doctor interaction. There's not so much of that as there used to be. I think you have to be the patient advocate, which I think most doctors are truly patient advocates, although I don't know if patients always believe that. But I do truly believe we are, and I think we need to, I guess, let them know that we are in a better way. Medical ethics is a very important part of medicine, and I think medicine is one of those fields where you've got to be a continuous learner and a continuous educator.